Frozen shoulder can happen when there is a hormone issue such as thyroid, estrogen. There are things that can happen to trigger this inflammation sequence that happens in your shoulder. If you have not seen, I have a frozen shoulder playlist. I have a TikTok series on frozen shoulder because it happens most commonly in females who are postmenopausal. Note when estrogen leaves the party, because estrogen is important for your fascia, ligaments, tendons, and how your bone remodels. And sometimes women can wake up one day and their shoulder is frozen. However, if you think you have frozen shoulder, I need you to go to your primary care doc. I need you to tell them. They will do blood work to make sure your thyroid's fine, to make sure you don't have undiagnosed diabetes, to make sure all these other systemic things are okay. And it could just be that you're postmenopausal. Now, sometimes frozen shoulder happens because there is another underlying injury, and that's another reason you need to see your doctor to make sure that you don't have a bicep tendon tear, a labral tear, a rotator cuff tear. You can ask for a prescription for physical therapy. If they prescribe you steroids, fabulous. If they do x-rays, fabulous. If they refer you to an orthopedic doctor, fabulous. I believe running right at treatment for frozen shoulder is very important because frozen shoulder is very painful, and seeing a healthcare provider helps you speed that process up. But what you do at home is also equally important. And so I am so sorry you have frozen shoulder. Check out my playlist, ask questions, check out my TikTok, talk to your doctor. You can do this. I believe in you. It's just going to take time. I'm so sorry.